simple. But again, I go back to these guys here. We can't forget these guys. So as we deal with health problems, this is the foundation, y'all. It's the foundation. You've got to have the good nutrition. You've got to have the exercise. You've got to have the water. You've got to have the sunshine. You've got to have the temperance or making right decisions. You've got to have the fresh air, the diaphragmatic breathing. You've got to go to bed on time, get good sleep. You've got to trust in God. And the one I've added, I do 9 now instead of 8. I've added, be happy. Being happy we find in the Bible. Being happy we find in inspiration, where we get these. And I find that one's very important. There are people who are just, there's people who are just mean as a striped snake. And those people are sick a lot of times because their body, it just tears their body up. Be happy. Don't be Pollyanna. Be realistic. If there's a problem, deal with it. But, look forward and keep going. It's true, a lot of people can't let go of their pasting. And I don't remember, I've got 2 things going on right now. I'm doing my morning program and I'm doing this, so I don't remember if I mentioned this. Dr. Walter Strachan, he said he's a psychiatrist from Loma Linda. He also worked a lot with Uchee Pine. And Strachan said, as you were saying, people have problems from the past. There are so many in psychology out there that say, oh, we got to go back and we got to get that person to admit to it. We've got to get in, and it just opens the whole thing wide open. I'm looking across here. I don't see any children. Yeah, I do. Okay, so I'll be careful. I had a patient one time, 36-year-old, I believe, male, motor vehicle accident. He was quad. We were doing some rehab on him. His wife, same age, and she was devastated. And so she started going to a psychologist, and he goes, well, and she was talking about, how hard it was. Her husband wasn't there, and she missed, having that support. And he goes, you need to go find somebody else. So she starts finding somebody else, going out and trying dating or whatever. And she said, well, I'm not having my needs met. He says, well, you need to go to somebody and get those needs met. And then I learned this because she's telling my nurses as it's going on. And then she then feels guilty because she's married to this guy. And he goes, well, you shouldn't feel guilty. It's not your fault. He had a motorcycle wreck. A motor vehicle, like he was in a car. A motor vehicle wreck, and he's a quad. That's not your fault. You need to tell him, so you unload that responsibility on him. So she goes and tells him that she's been out. He died in 2 weeks. He gave up. That is the challenges you get when you don't go to Christian counseling. Christian counseling is so important. Well, Dr. Strachan said, yes, identify something terrible, awful happened. And it was. It could have, who knows what it might have been. There's all kinds of bad stuff that happens. Identify, yes, it happened. It was terrible, awful, but we can't fix it. So what can we do? We can look forward and we can look to Jesus and help that person move from here to here and focus and be positive. But having OCD wallowing in the mud is not going to fix it. And that's why I believe being happy, being positive is so helpful to health issues. I really do. This is Appalachia. Any of your grandmas look like that? I had a grandma that looked like that. My grandma, who looked like that, let me tell you, if she shook her hand, you went down to the ground. It was, she milked cows. That lady was so strong. One time I said, I like dogs. I like cows. I like horses, but I like dogs. And I wanted the dog with a purple tongue, a chow. I want a chow. And she raised chows. And I said, you know, when I get out of school, I was in college at the time, and I said, you know, when I get out of school, when I get married, I'd really like to get a chow. And she says, no problem, just let me know and I'll grow you one. I'll grow you one. But these were the doctors. These were the doctors. Then we go back further, and the Native Americans. Whoa, those guys. Who was talking about Navajos earlier? Who was? So the Navajo. I enjoy learning from the Navajos. They have so much knowledge on herbs. I enjoy learning from. I'm near Cherokee, North Carolina. The problem is they don't trust us. Right? Because it's spiritual. And they don't want us to adulterate it. But if we can gain their trust, we can learn so much about herbs from these guys who really have these are the doctors. Those guys really know herbal medicine. And then we go back further in the Bible. Clay? Do people use clay? Where are you from originally? Where's your family from? Cuba. Go back into South America. South America they're big into clay treatments. And they will put clay all over people. And it's amazing what clay can do to help. And did Jesus use clay? Now here we have Job. He's setting the ashes. Now to make ashes work, to charcoal to make charcoal work, it's got to be wet. But you know, it's amazing which the charcoal, activated charcoal that we use for. The best thing I have found for food poisoning is activated charcoal. I normally find food poisoning is gone within 30 minutes. No more than 45 minutes to an hour. Gone, plumb. Once you feel that onset of the food poisoning. It's amazing. There's two things you have to be careful with charcoal. We'll cover those in just a moment. But remedies by diagnosis. I love wound care. Wound care is fun. We did a lot of wound care where I used to be. I like wound care now. This is a foot that a physician called me, this guy's physician, and she said, Walt, they're about to amputate. Is there anything we can do? So this is what we have. Not only does he have a foot that looks like a shark took a bite out of it, he's got diabetic neuropathy. He also has osteomyelitis. This is in 2 weeks. This is at 4 weeks, and we're ready for a graft. Is that not amazing? We did not get that where I used to work. No way. Carrington products, whatever we used, did not do this. Wound vacs, whatever. We did not get this aggressive treatment. So what we did is, number one, I learned in wound care, there's a couple keys in wound care. Number one, nutrition. You've got to have adequate nutrition in wound care. Number two, you've got to have excellent perfusion. You cannot have a person sitting in a chair, laying in a bed. I mean, a hospital is a great place to get an ulcer, a bed sore. Why? They're not turning them. You got to turn Q2 hours, 24/7. You've got to keep the pressure off. You've got to keep that capillary pressure down. You've got to have a good overlay. My best bed that I ever dealt with was called a Clinitron bed. It was developed by the VA for burn patients. It looked like an air hockey table. It had glass beads, and you turn it on like an air, and they would float. If you had to do CPR, just turn it off, boom, you could do CPR right on it. There's not a problem. Excellent product. So number one is nutrition. Number two is you've got to have perfusion, and so you got to increase that blood flow. Perfect health is perfect circulation. So first thing we did is the best thing I have found to just get copious amounts of nutrition in a person. Who remembers Calvin Thrash? Remember Cal? Dr. Thrash said, When you put a person on something like a juice fast, you're doing two things. One, yes, you're giving them copious amounts of nutrition like Hyperal or TPN, total parental nutrition. But the other thing is what they're not intaking. They're not getting the standard American diet. They're not getting the junk food. And so you're doing two things by doing that juice fast. So I juice fasting. We did 16 ounces 3 times a day. The next thing we did is because he has osteomyelitis, we used something called Alimed. And Alimed is just phenomenal. And so we did 1 teaspoon twice a day, PO. Then what we did with, what's a way I can increase perfusion to that foot? Okay, with like far infrared or whatever. Okay, what else? Hydrotherapy. Now some people say, Walt, you cannot do hot and cold on this. I agree, you cannot do hot and cold. That foot cannot tolerate hot and cold, but can you do warm and cool? Absolutely. Textbook says 103, 102. Don't go above 100. You will not get blistering at 100. You can get blistering at 103. I've seen it. So we did 100 degree warm. We did 70 degree cool. The skin can tolerate that. See, vascular flow is important here. And when you don't have that good vascular flow, or if you have some major issues here, you don't want to do hot and cold. The skin's too tender for this. So you do warm and cool. So we did 3 minutes warm, 1 minute cool. 3 minutes warm, 1 minute cool. Vasodilation, vasoconstriction, vasodilation, vasoconstriction. 7 times, twice a day. So we did the hydrotherapy. Then because he has the osteomyelitis, we then sprayed Alimed in there, topically. So we have it PO, systemic. We have it topically, transdermally. Putting the Alimed in there to deal with the osteomyelitis and any other infection we may have. And I'll tell you why infection is very important for this man. This guy is not in the United States. He's down in Honduras. And I'll explain in a minute why I was concerned about sanitary conditions for this man. Then we put a salve in there. And you paint the salve in there. And you use golden seal, myrrh, frankincense. Sound familiar? And we didn't have pine sap. I like using pine sap, but we had bee propolis, so we did bee propolis. And then we did aloe vera. We made that salve, and we painted it in there. We didn't want to pack it in there like we used to do betadine brown sugar. Remember when we used to do that? We didn't want to pack that in there because in 12 hours later, we're going to do hydrotherapy again, and we want that to slough off, and then we want to be able to put the Alimed and do it all over again. And then we put a charcoal poultice on there. In 2 weeks, here he is. Here's the problem at 2 weeks. The doctor calls me, Walt, he's walking around the village, barefooted. I said, put him on the phone, let me talk to him. So I said, sir, you're doing great. Look at your foot. But it's not going to heal up if you walk around town or the village on that foot, barefooted in that dirt and whatever else. And so sometimes you have to exaggerate. And so I exaggerated. I said, sir, keep that foot up above your knee. Use crutches, but just hop along, but keep that foot above the knee, because if it's a little bit below, at least it's off the ground still. I didn't say keep it a foot off because it might fall down more. So keep it up here, and then he did great. And then we're here. You can look at this. Look at where you have full healing right here. We've totally filled out, and now it's ready for a graft. Not only did the foot heal, the osteomyelitis is gone, and within that amount of time, his diabetes was gone. His blood sugar was normal.
I remember quickly, I was in Canada, and I was trying to get one, and the man had a heel that was cut off. And every day I took him in high pH.
The leaven.
Yes, and he soaked that foot into it. It started to grow back. When I left him, he was fine.
It's amazing.
Yes.
Just natural remedies God has given us. Yes.
I want to show you this. I went to see this, help this woman in Trinidad.
Okay. This is now?
Yes, she has calcium.
We need to talk. But tell me, what healed that? Period. Period. God does the healing. But it's a relationship that, yes, God can plumb heal. And He does plumb heal. Inspiration says, in the end times, we will see less healing and we'll see a combination of medical missionary. And the one who told me that was Elder Richard Marker, president of the New York Conference. And he read that quote to me. And he said, what happens is the end time, Satan will be doing healing. Do we not read that? But what will distinguish the healing of God will be the implementing of natural remedies and God blessing. And so God wants to work with us. And see, the goal is not to heal that foot. What is the goal? To point the sin-sick soul to Christ. And so if you just said you had a prayer, God please heal this foot, and you left, do you have an opportunity to have friendship evangelism? The key is friendship evangelism, and this church is starting that. Friendship evangelism is the key, y'all. You can't just go out there and toss seed and then walk away and say, God's just going to make that grow. You've been gardeners. You got to prepare the soil. You got to disc it. You got to plow it. You've got to pick up the rocks and the sticks, and you got to plow it and disc it again and pick up the rocks and the sticks. You know what clearing land's like. And then you got to plant it. You got to water it. You got to pick the weeds. You got to cultivate it. All that takes time. And as that new Christian, that person who's starting to learn about Christ, you're able to spend time with them. As you're working with this, and then you're working with this, you're praying, you're giving glory to God, and then you say, look what Jesus did for you. Don't take the credit yourself. You will fall and bust your nose. And so it's a relationship that's going on between you and God that causes this to happen. And so here's what we do. What I just mentioned. Honey's also another great one you can put on there. A poultice can also be a cabbage poultice. But again, if you have a wound, I've not found good success healing wounds with tobacco utilization. A guy comes in with a little wound on his foot. Yes? Yes, ma'am? Guy comes in, a little wound on his foot. They've been treating him at the VA center in Johnson City for a good period of time. It was not healing. I mean, I'm talking a little wound. Only as big as around as the tip of my finger. That's small. And it would not heal. So I started doing this. And we did this for a couple weeks. And it would not heal. So I called a buddy of mine. He's a surgeon. We used to work together. And he does natural medicine now. And I said, it just ain't healing. And he said, what are you doing? And I told him. He says, yeah, that's what we do. He said, he don't smoke, does he? I go, oh, that's it. Yes, he smokes. He goes, Walt, it ain't going to heal. You tell that boy to quit smoking. So I went out there and I said, sir, this surgeon friend of mine, he's a good bit older than I am. Everybody's a boy to him. And he said, I said to him, I said, sir, this is my fault. It was. Be honest. It's my fault. I did not tell you to quit smoking. And it ain't going to heal until you quit smoking. And I just called a buddy of mine, a surgeon. He said the same thing. He goes, I ain't quitting smoking. I said, and so I started explaining, it's a vasodilator. And you can't get good perfusion. And not to mention the other toxins in those cigarettes. It's just not going to heal right. He said, I don't care. I ain't quitting smoking. I said, sir, I've done all I can do. And I never saw him again. You got to quit smoking. Whoop. Pardon? Oh, which one? You got it. Okay, good. And you have good nutrition. Pine sap. Who's ever used pine sap? Pine sap is amazing. Every one of my 6 grandkids has used pine sap for teething. It's a great teething tool. It's great for wounds. I'll tell one on Franklin Cobos. It's been years ago. This has been 20-some years ago. Franklin was just starting to move from he was in emergency medicine, and he'd read this book, Ministry of Healing, and read a couple more books, and he's starting to go, what do I need to do? And he started exploring natural, and he came where we were working, and Mary Lou cut her hand slap open on something in the garden. And so I took her into work, and because it needed sutured up. And so Franklin looked at it, and y'all know how Franklin is. He gets excited like I do. He goes, "Ooh, can we try something?" And I said, "Yeah, let's try something." He said, "Can we put some pine sap in there?" I said, "Sure." He goes, "It heals a whole lot faster." And so he put some pine sap in there, then he sutured her up, and boom, it did. It healed a lot faster. Pine sap, the only type of wound that you do not want to put pine sap on is a puncture wound, a nail, a dog bite, a cat bite, because it has gone down in and you can't irrigate that out. Or if you can irrigate it, it's fine, but you've got to fully be able to clean it out. And if you put the pine sap on top, it heals it so fast you can then tunnel out. You know how wounds can tunnel. And so I like using, like soaking Epsom salt and massaging and stuff like that. But be careful you don't put pine sap on that. But pine sap's amazing. We use it wounds, gum sores, mouth sores, immune system, cutting teeth, pain, headaches, activated charcoal. That is what charcoal looks like. That is why charcoal has so much surface area. That's why it adsorbs so well. It does not absorb. So here's the difference. If I put some flour on the table and I take a sponge, a dry sponge, and bring it across that flour, it's going to stick to the sponge, yes? That is adsorbing. It's not going soaking up. If I put some water here and I come across the sponge, it's going to soak into the sponge. That is absorb. So this is adsorbed. It sticks to it. Now I have a customer. She's a PhD, works at Oak Ridge, and guess what her specialty is? Charcoal. Charcoal at Oak Ridge. Charcoal is used to separate and pull certain chemicals and things out of stuff. And she said you can actually clean charcoal. And these industries which use charcoal for separating and cleaning stuff, they will then wash the charcoal and then reuse it. We don't, the little that we use it, we don't need to do that. There's another thing is charcoal is not all equal. There is some with micro, macro, medium, and based on what they're trying to pull out, they will use different charcoal, she said, for pulling different substances. We don't have to worry about that for what we're using it for. Just use any of it and it's going to do the job that we're looking for. Food poisoning, indigestion, acid reflux, IBS, detox, foot bath. It's excellent as a foot bath for gout. You can also use a poultice for gout. But when internally used, do not use within 2 hours before or 2 hours after medication. And I think I mentioned this the other night. I had a nurse that gave way too much morphine one time. She read the MAR wrong. She called me, Walt, I gave way too much morphine. Fortunately, it was by mouth. And I said, protocol, use the charcoal. Gave the charcoal, boom. No adverse effect, none at all. Just soak that morphine right up.
For using charcoal for food poisoning or anything, like how much are you talking? What do you use? I was using like a tablespoon, and Dr. Agatha told me, she says, you can just use a teaspoon. I was hitting it hard, and you can still use the tablespoon, but Dr. Agatha would just use a teaspoon. Yeah. Now, if you use the powder, if you haven't used it yet, it tastes like dirt. And so you can use a straw, and it throws it back up across the taste buds. Yes, ma'am. It works really well for children to mix it up without the sauce.
Yes.
They don't even.
Excellent. Good. Yes?
Do not put it in hot water and shake it up, because I told my daughter to use charcoal, and I always put it in cold water, but when she put it in hot water, it exploded.
Really?
Yeah, all over the place.
Wow, I've never done that.
When I start to get cold, I'll take a teaspoon of charcoal and put it on the back of my tongue right before I go to bed, and just stick my tongue up the roof of my mouth when I get up in the
Yeah.
morning. It's gone.
It's phenomenal. Yes?
Activated charcoal, do they use chemicals to make it activated charcoal?
No.
I
No.
looked into that one time, and the way they said to do it was, they use some kind of chemicals to make it where it has more holes in it, and then they said you could use, make your own out of lemon juice.
Okay. So you don't have to do either. So here's what you do. Anybody ever worked in firefighting? Firefighting. Has anybody been a firefighter? Okay. Y'all know what a backdraft is. So what happens in a backdraft is when we roll in, we look at the windows, or the windows moving. We call that house breathing. We can see the windows moving. We can see the windows turning yellow. We see smoke going in and out, and in and out. That's the breathing we're talking about. What has happened is the fire has burned down to below. See, it takes three things to cause fire: heat, fuel, and oxygen. You take any one of the three away, fire goes away. If oxygen drops below 16%, fire goes into smolder. And so what happens is you've used up all of the available oxygen down to below 16%, flames go out, and now it's just smoldering. In a backdraft, you open that door, you add copious amounts of air in, it explodes. You can I've seen a front door blown off the hinges when they open the front door. It can happen. It can blow a whole wall out. So what you do in making activated charcoal, in the time Mrs. White, she would talk about going to the blacksmith, and they used charcoal for blacksmithing. That's just regular charcoal. Activated charcoal adsorbs better. It just works better. You can use just firewood, and it works fine. Firewood. Yeah. So there's three ways to say that word. You can say far on the mountain. You can say fire like a person from the south, or other people say fire. So you can make your own, and you can take it, and just to make regular charcoal, you can cut up the sticks and bark it, put it in something, roll it up, and put it in a fire, and it will make charcoal. But if you want activated charcoal, they have buildings that do this commercially. But all you have to do is dig you a hole in the ground. Put your wood, get it burning real good, get it plumb burning. Then put a piece of tin across the top of it and throw dirt on top of it. Then because it's been fully involved, then you now cut that oxygen off, and now it goes into smolder, and leave it there for a couple days, and it will smolder down, and then you come back and dig it back up and bust it up, and you have activated charcoal. So it's taking the oxygen level below the 16%, going into the smoldering stage. That's the best way to make activated charcoal. Yeah. Charcoal is really good. Now, be careful with charcoal. Do not use it within 2 hours of a prescription. So if I get a young girl, childbearing age, and she comes in to get activated charcoal, I say, if you're on birth control, don't take it within 2 hours, or it ain't going to work tonight. And so, if you're on naloxone for tachycardia, if you're on whatever, or if you're on whatever kind of medication, it will adsorb it, and it won't work. Charcoal poultices. One thing, a charcoal poultice, you can add water to it and it work. But once that water evaporates, it quits drawing. It's got to stay moist to continue drawing. So you can add flaxseed, oatmeal. The best is I hired a therapist out of Switzerland, and that's the best charcoal poultice I've ever made. It's real simple to make. It's 1 part charcoal, 1 part psyllium,
powder. Now, psyllium powder is not all equal, and you can have the same company and have each different batch can be different, so you have to test it each time. But the key on it is 1 part charcoal, 1 part psyllium powder. Now, this is key. Mix it thoroughly. If you don't mix it thoroughly, the psyllium will congeal, and you'll still have a mess with the charcoal. So you have tan, you have black. Mix it till it's gray. You see no black, you see no tan. No tan. You want it gray. Then you add your water. Don't add it, don't take a while because it's going to congeal fast. So start out, you want 5 to 6 parts water. So start out at 5.5 parts water, 5.5 parts water. That gives you a little edge because if you needed extra, you're only a half off instead of at 5 and you said, I need 6 and it's too dry. Because you cannot add water again once it's made with psyllium. Or if you go 6 parts and it's too liquidy, then you can't add the psyllium, more psyllium, it's too late, it's done. And so going 5.5, and then you can get an idea of your next poultice on that batch, whether you want to stay at 5.5 or go to 5 or go to 6. Does that make sense? Okay. And then I'll put it out between a piece of saran wrap, and I'll put it on there. I put another piece of saran wrap. I smash it down, roll it out to about 1/4 of an inch thick. Charcoal poultices, they can tattoo, especially if you use other than the psyllium. I had a nurse work for me. She was from Colombia. This was 20-some years ago. And her father in Colombia, she had a wound, and he put a charcoal poultice on her. And he did not put anything as a barrier. And the size of that wound was a dark spot. Now, Colombian, she has skin like yours. But it was dark because they put a charcoal poultice on there. So if you don't want to tattoo yourself or tattoo the person you're working with, put a wet piece of paper towel. When Mary Lou and I went to Venezuela, and she's been there several times, I don't go to Venezuela no more, but when we did go, do the Venezuelans have paper towels? Probably not. Where we were, they didn't. I mean, they even rationed their toilet paper to 2 squares anytime you went to the bathroom. No matter why you went to the bathroom, 2 squares, that's it. They don't have the luxury that we have. Yes, Mary Lou? Oh, and so in Venezuela, or if you don't have, and someday we won't have paper towels. And so what they do is they use an old sheet, and they'll put it in the old sheet, apply it on there, and it will draw through that wet sheet, and it won't tattoo. I use the paper towel. I think it works a little bit better. But now I don't even do that. Well, maybe. I'll use the psyllium, and with the psyllium, it has much less propensity to tattoo. You usually don't tattoo with it. But if it's not you, I've never had a problem with tattooing on me. But if you're doing someone else, especially if it's on a face or somewhere, or on a lady who might be a little more cautious, then put that wet paper towel in between, and you won't tattoo. But you've got to keep it. Moist. If you've made extra of the psyllium one, you can just it will mold, just like Grandma's bread. If you didn't eat it fast enough, it's going to mold. The psyllium doesn't have preservatives; it's going to mold. And so, even though you put it in the refrigerator, it'll last about a week. But if you have more than what you need, cut it, put it in a Ziploc baggie, put it in the freezer, and it'll last for years. Pull it out, thaw it out. But when you thaw it out, if you do use a microwave, which won't be a problem in this case, I did get rid of my microwave when I learned the harmful effects of microwaves, but then I realized, wait a minute, what am I going to heat up my fomentations with? So I had to get another microwave. Yes?
I just asked with the flax. I use the flax to do the poultice and put it in the freezer, but it breaks and I take it out. Is it better to use psyllium?
Psyllium works better. It really does. And so then you can, but be careful with the microwave because the psyllium poultice will hold heat. And so make sure that, that you don't heat it up too much or allow you to cool it down. It's nice to use a warm charcoal poultice. Why? Yeah, a charcoal poultice is drawing. Yes? and you want transdermal. And heat is a vasodilator, and it opens those cells, those pores. It dilates so that you can transdermally pull out better. And so a warm charcoal poultice works better than a cold charcoal poultice. So that warm charcoal poultice is good, but just don't make sure it's not too hot that it'll burn them.
35 years ago, when I was rash apartment, we learned to do flaxseed charcoal, always in an iron skillet.
Mm-hmm.
And always have to be an iron.
Now you know what iron is, right? I totally understand iron. Go ahead. For y'all's on listening out there, it means iron.
I can translate the game. But now, is the psyllium now better than the flaxseed?
Yes.
I've used
The flaxseed works.
overnight and took birds out of supply.
Flaxseed and the psyllium will work equally as well. It's just the preparation is less messy, and it's easier to make before. It's just an easier tool to work with. But the flax will pull just as well, and it's going to be more economical. And when I sent Mary Lou off to Venezuela for 3 months when she had the breast cancer, and she did very well down there. She come back home, and then it got worse again, and we ended up doing the treatment we talked about yesterday. But to save money, what did y'all do? So she used a combination. She didn't do plum half and half. And so it had a lot of flaxseed in it, but still was better than just plum flax psyllium in it. Okay, again, never use over an open wound. Place a barrier, wet paper towel. Infected wounds, stings, bites, inflammation, gout. It's great for gout, pain, cancer. Eye infections, a great tool for eye infections. I like the psyllium because you can break off a little bit, about the size of that digit right there, and you stick it in there like a piece of backer and hold it against the gum and the jaw, and it will pull that toxin out from where that infection is, and you throw it away and put another one in there. It works really well. Before I learned to do this, I would take a paper towel in the flaxseed, and I make it a little pouch, like a little tobacco pouch, and stick it in there. But the psyllium one, you can just stick it plumb in. Yes, ma'am. It is. Her question is, can you use the coconut along with it? Absolutely. It is. It helps to draw out. My dentist, who's a biological dentist over in Knoxville, he uses oil pulling. And yes, he's found it to be very beneficial. I'd leave it on for several hours and then take it out and put another one in. The question is, how long do you leave it in? Infections. This is from the CDC. Antibiotic resistance. I'm quoting straight from the CDC. Antibiotic resistance is among the CDC's top concerns. Upper respiratory infections account for 3/4 of all antibiotic prescribed by office-based physicians. Upper respiratory infections account for 3/4, 75% of all antibiotics prescribed by office-based physicians, according to the CDC. Antibiotics are often used inappropriately. More than 10 million courses of antibiotics are prescribed each year for viral conditions that do not benefit from antibiotics. Why? The patient demands it. I had this guy come in recently. He was mad as a cat on a hot tin roof. His boy had a virus, and he went to the ER, and that doctor would not give him an antibiotic. And I said, that doctor did his job. The patient, the customer, was demanding an antibiotic. And some docs will say, get them out of here. And so it's an issue. This is Infectious Disease Society of America. The losing battle against deadly bacteria is a public health crisis. So we have, what can we use for infections? Allicin, golden seal, vitamin C, olive leaf extract. Olive leaf is an excellent antiviral. Colloidal silver. Nutrition. Managing stress. That's good for keeping infection down. Hydrotherapy actually helps with infection. Charcoal poultice can be used. Garlic. Garlic is amazing. And the neat thing about garlic, so the difference in garlic and golden seal is you can use garlic every day. You can cook with garlic.
Yeah, my husband told me last night, you can tell I ate garlic. So whoever put garlic in them. Yeah.
He found out. Look at cultures that eat people, groups that eat a lot of garlic that can have a different infection rate because the garlic is very beneficial. This is National Institute of Health. Allicin. Allicin is a component within garlic. So you take two components of garlic, put them together like an epoxy, and when they're put together, it makes allicin. Now, allicin has a very short lifespan unless it's stabilized. And only one company have I found to do a good job stabilizing it. And I get it out of England. But let's talk about allicin. Allicin is an active ingredient of garlic that has antibacterial, antifungal, antiviral, antiprotozoal activity. Again, I'm reading from NIH. Allicin exhibits various biological properties like antimicrobial, anti-cancer, antioxidants, immunomodulatory, anti-inflammatory, hypoglycemic, and cardiovascular effects. And we do know that it will lower blood pressure, it will lower cholesterol. It's huge. Allicin, it's a natural OTC, antibiotic, antiviral, antifungal, which does not require a prescription. Does your clove of garlic, does that require a prescription? No. It's what God gave us as it's healthy for us. What is allicin? It takes 24 cloves of garlic to make one drop of allicin. 24 cloves of garlic to make one drop of allicin. It's very, very potent. It's kind of like, do y'all know what bromelain is? Bromelain? You could eat a mess of pineapple or you can use the bromelain. Or let's say that D-mannose. Who knows what D-mannose is? It's amazing. I've got a couple urologists in Knoxville that will send their patients to us to get D-mannose. I've got a urologist in Asheville, North Carolina, that I ship it to. If you have a UTI, the fastest thing I have found for a UTI is to use 1 teaspoon of D-mannose every 2 waking hours in forced fluids. And the way it works is it goes in and usually E. coli, but the pathogen will start eating on it. And as you force fluids, it's like a dump truck and it carries it out. What does D-mannose come from? It comes from cranberries and it comes from blueberries. So one day I'm walking on the floor. I pass the nurse's station. Physician's telling the nurse, give Mrs. Jones 1 cup cranberry juice, Q meal, every meal. The dietitian happens to be sitting at the nurse's station charting. She says, that ain't enough, you're going to have to use a quart. Now, is a quart of cranberry juice a good thing 3 times a day? That's a lot of fructose. She's got an infection. So what they've done with D-mannose is they've isolated just the D-mannose out of the cranberry or the blueberry in 1 teaspoon, and you want to do it every waking 2 hours. It's phenomenal. It works for any of the urinary tract infections. It even works for IC, interstitial cystitis, and that's what the urologists are mostly sending the folks for, is it for IC, and also for honeymoon syndrome. And so if you have ladies come in and they tell me the itching, stinging, burning is gone within 15 to 20 minutes. It's very rapid. I'll have them come in the store. We're just country people. And people come in and they can go fill up the water jugs, carry it to the car, and come back in, pay when they're finished. They'll come in and let's say that she's got a real bad UTI and she'll go over and grab the D-mannose, and we've got folks we're dealing with. She'll go ahead and just shake some in her mouth and go back to the deli where the spoons are. She'll get her a spoonful of it, and when she can get through, she pays for it. We're just country folk. And it works very fast, very rapidly. But if you don't force fluids, forcing fluids through urination is what carries it out like a magnet or like a dump truck, and now you're putting a new dump truck in every 2 hours. If you have a person who has a propensity to UTIs, then you can do 1 or 2 teaspoons, a day, and that can be prevention. But the key is, why does a person have the UTI? Let's get to root cause. It could be they're not drinking enough water. It could be, an old doc taught me years ago, he says, Walt, them dark drinks make you more prone to UTIs. Drink water. It could be because the underwear they wear. You know, they need cotton underwear. They need breathing. It could be that they're wearing tight breeches. Tight pants makes a woman much more prone to a UTI. And it could be because of hygiene issues, just the way the plumbing men and women are. And so you want to address all of those issues. And don't just say, well, we'll just take Dimanos. No, let's fix the problem if we can. So D-M-A-N-N-O-S-E, Dimanos. Yes, ma'am. But these are things that Allison is good for. We sell it to docs all over. They use it for H. pylori. They use it for C. diff. They use it for... it's amazing. Blows the doors off vancomycin in dealing with MRSA. I mean, much, much more effective on MRSA than vancomycin is. It's very powerful. And it's an OTC. Immune system. We talked about this yesterday, so I won't get into that one. Boils. It's nice to say boils, and y'all know what I am. I'm some places and they go, huh? They don't know what a boil is. Mm-hmm. I tell you what, can I send you these slides? And then you can send it out to everybody if they want it? Okay. Okay. That's funny. Okay, so bowls. Who's ever had a bowl? They're painful? They're painful. I remember the first one I ever had, I was in elementary school, and finally my daddy held me down, my mama lanced it. And this old hard thing come out. And then I had a sebaceous cyst, and about 22, 23 years ago, I had this sebaceous cyst that would just move around here. And one day I was in a rush, and I'm always in a rush, and I'd go around the corner and I hit the nurse's station, boom, and it hit it, and it burst it. And it was painful. It then turned into a boil. So I found a huge disparity based on what I did versus what I had done before. Normally, I have people that have boils. I've never been to a place that had boils like where I am. They're just a bunch of people get boils. But it's not as much as it used to be for some reason. But when we first went there, a mess of people came in with boils. Usually skin issues or blood issues. Yes, you can have poison ivy and poison oak and poison sumac and you scratch yourself. But a lot of times, eczema, rosacea, psoriasis, Dr. Agatha taught me, you got a blood problem going on. There's something going on in the blood. So it's coming out through one of the methods of elimination. And boils is usually a pure blood issue. In chaparral, burdock, red clover, my favorite is chaparral. That's powerful. And I learned that. And who does it? The Navajos use it for blood purification. A charcoal poultice is what I put on. And the poultice caused the pain to significantly diminish. And then the pain would come back. What did that mean? It sucked up all it could. I'd take it off, throw that thing away. It is nasty. It's pulled toxins out. Throw it away, get you another one, and boom, the pain goes back down. And just keep applying it on there. Allison's good. Again, cleaning up the blood, nutrition, water, insomnia. Oh boy. We'll finish on this one. See, we're already plumb out of time. This is a big problem, and we're definitely seeing it post-COVID. Even worse than what we saw before. And what I'm finding is it's not a cookie cutter. What works for you may not work for you. The other problem is what may work now, like deodorant. You know how deodorant is? It quits working after a while and you got to use a different kind. Boom, it quits working. You got to find something else that works. And so I'm attacking sleep issues twofold. One, is it because you can't fall asleep? You can't turn this off. That's my problem. I'm used to having 200 and some employees working for me. And so my brain's used to I got to think enough to keep them people busy and know where we're taking the ship and where we're going to be 10 years, 15 years down the road. I don't have that in my little store, but my brain still works that way. And so Mary Lou knows that she'll go, here, take some ashwagandha. And the ashwagandha will just turn my brain off. It does not put me to sleep. It just turns this thing off so I can then fall asleep. Ashwagandha can be taken in the daytime. If you're stressed out, ashwagandha is good for a lot of stuff, but let's say there's a lot going on and you need to focus a little bit better because you're just so much going on, take some ashwagandha. It can help you out a little bit there. Well, there's some things you can take to help you calm down enough, and then there's things to help you sleep. And that's the challenge. Yes?
Ashwagandha is also good for inflammation.
Good. And good for migraines? Excellent. Okay. See, God, did you notice when we looked at herbs how many things it's good for? It's huge. God's good. Okay, so let's look at some things. Valerian, skullcap, hops, passion flower. When 9/11 hit, our patients out of New York City and Washington, D.C., they couldn't sleep. I just couldn't get them to sleep. So I called Dr. Strachan, the psychiatrist I was telling you all about. And Strachan said, take 2 tablespoons of valerian, 2 tablespoons of hops, 2 tablespoons of valerian, skullcap, and hops, each of them 2 tablespoons powdered. Put it in 2 cups of water. This guy's a psychiatrist. His last 14 years working as a psychiatrist, he did not use pharmaceuticals. He used herbal medicine. Isn't that cool? That's amazing. He says, it will work. So we did it. He said, give it to him tonight at 8 o'clock. So we gave it to him. It didn't work. So I called Strachan the next morning. He goes, wow. He says, if I have a lady whose husband just died and she's in hysteria, it's always worked. He says, this is serious. He says, okay, let's back it up 2 hours. Do 6 o'clock, full dose, 8 o'clock, full dose. We did it that night, did not work. He says, okay, these people are really fractured, and that's the word he used, fractured. He says, okay, back it up every 2 hours until it works. That night we did 4 o'clock, 6 o'clock, 8 o'clock, did not work. The next night we did 2 o'clock in the afternoon, 4 o'clock, 6 o'clock, 8 o'clock. It worked for everybody. And so for 6 months, every patient we got in from New York City, we would test it. And every one of them, we had everyone to get it to work. We had to do 2, 4, 6, 8. 2 tablespoons of valerian, 2 tablespoons of hops, 2 tablespoons of skullcap, powder of each. That's a lot in 2 cups of water. Water's only the carrier, so the water doesn't matter. It's just the less you use, the nastier the valerian is. But there's a couple more things as you're looking at sleeping. One is the room cool. There's a new mattress that you can buy, and that you don't have to use an alarm clock. The mattress, you set it for 6 in the morning, and all of a sudden the mattress is kind of cool. The mattress gets hot. It starts warming up right before 6 o'clock, and it turns hot at 6 o'clock. It wakes you up. That's your alarm clock. This is cool. There's an Orlando Fire Department now has a new alarm. You know, you're used to fire stations going, station 23, you got a structure fire, such and such. I mean, it's like, it wakes you up out of the night. And they say it's really not good for your heart, you know. And so now what they have is they got this real nice voice. Station 23, you have a structure fire. Station 23, you have a structure fire. Station 23, you have a structure fire. And this female voice just gets louder and louder and louder. And that's what the Orlando Fire Department now uses, is that woman doing that for the alarm. So it just out of your sleep. And I can tell you, I've lived in a fire hall, and you have that buzzer, right? You know, that buzzer in the school, and that thing go off. I mean, you're up, and that's just not the best for you. And so, at the house, Mary Lou knows. I mean, when the alarm goes off, boom, it wakes me up, and I'm ready to go. She's going, oh boy. It wakes her up too. So, you want the room quiet. You want the room dark. You want the room cool. You want the room neat. That's important, to have a neat room. And if you got things on your head, write it down on a piece of paper and let that paper remember it tonight. And then when you get up in the morning, you stick it back in your head because you're worried about forgetting it. Melatonin. I gave you something on cancer yesterday. And as you listen to that, and I encourage each one of you to listen to that, the doctor who's speaking on there, he says that any color than red turns off or turns down melatonin. And I'll clarify, that's not fully true. I'll clarify. So if you wake up and you look at your phone, there's blue light to see what time it is. Or you can't fall back asleep, so you look at your emails or your Facebook. Boom. That sends blue light, and your brain goes, time to get up. If you have a night light that is white, it will wake you up. The bathroom light is white. It turns down the melatonin in this research. And this guy who's done this study has published over 4,000 pages. That's huge. 4,000 papers, not pages, papers, on this issue of melatonin. Any color than red. So he says put a red nightlight. Have your clock red in color. And so when you look, it's not white or green or blue, it's red that says. Because any color other than red will turn down or turn off your melatonin. Except moonlight. Now that's a question. I have several questions when I get to heaven. Because scientists right now have no idea why moonlight does not turn off your melatonin. They have done research where they literally will put in a full moon on the roof and it still not affect the melatonin. It's still sunlight.
Sunlight is full spectrum light, so.
I don't know, but a street light or any of those other lights will plumb turn it down. And so as it bounces off the moon, now it's because the sunlight will turn off your melatonin. But when it reflects off the moon, it does not. And that's cool. I think that's cool. So there's things you can do to prepare for helping you sleep, but then there's things that you can take. Magnesium. I like magnesium. Magnesium helps some people fall asleep. Magnesium oil. You can rub it on the bottom of your feet, and it helps you fall asleep. Why are you having problems waking up? It could be you have pain. It could be you got to go to the bathroom. You want to find the reason and then take that cause away. What's causing you to wake up? Yes?
So how much is the valerian hospice?
Okay. So play with it to least dosing. So what we did is we did 2 tablespoons of each in 2 ounces of water, or 2 cups of water, but use the least that is effective. How much does it weigh? Usually you'll do like the child's weight is the percentage of adult dose. Yeah, and you're so flexible here with something like this, it's not going to be a problem. Because you can give the person as much as 2, 4, 6, 8. So with this, it's not a problem if you just do the child's age is the percentage. Their weight is the percentage. And that's what's common. So magnesium oil is a great treatment transdermally on the feet. Chamomile. We know that if you eat supper, if you eat a full supper, you don't produce as much melatonin. We know if you eat within 3 to 4 hours of laying down, the food has a propensity to putrefy and ferment. But in Neil's book, The Proof Positive, there's a guy in there, it's around page 30-something. His name was Dr. Koop. And Koop actually recommended his patients not eat within 8 to 8.5 hours before going to bed. That's amazing. And so we know that food has a propensity to putrefy and ferment, and so that affects your night's sleep. Tryptophan can help. B complex can help calm you down. Sunshine just helps to increase the serotonin, which then will help to then make melatonin. And there's other things. There's L-tryptophan. There's There's L-theanine. Mary Lou? Just nettle tea? Yes. Yeah, nettle is the most nutritious herb in North America. People will find copaiba. Anybody heard of a copaiba? Copaiba is amazing essential oil, and that is used by some people to fall asleep. I've got a guy who came in, and he had epileptic seizures. He had one in the store one time, only because I was trying to get him to try one of our smoothies, and this guy didn't do fruit. He didn't even hardly even do vegetables. He just ate steak and French fries. French fries was his vegetable. And so he was a friend. He wanted to please me, and so Mary Lou made him a smoothie out of fruit, and he gets up to get it, and he goes, and he falls on the floor and has his grand mal seizure because of stress. And this guy had multiple grand mal seizures a day. He was a building contractor, had to quit working, could not drive. He has been over 4 years now with no epileptic seizure, and what he uses is copaiba. And that's the only thing he's done. Nothing else would work. Nothing else would work. I don't know. It's an antispastic. He wants to know if it works with... yes. So I can't answer that. But I do know that copaiba has been identified as the most anti-inflammatory phytochemical found on Earth. So it is an excellent anti-inflammatory, where it would be worth a try. Pardon? Oh, absolutely. It's great for arthritis. Mary Lou, help me out here. Copiaba. What? Copiaba. That's it. Yes, thank you. If you want to learn about copaiba, find somebody from Brazil, because it comes from Brazil. Yes, there are some other countries in South America, but most every Brazilian knows about copaiba. Kind of like people in the South know about kudzu, but they just don't know how to use kudzu. But the Brazilians know how to use copaiba. Yes.
I had an experience where being in the garden and this and that, for years I have been pulling my weeds by hand. It's so aggravating. And as soon as I spent 2 weeks pulling weeds in one area, and after I had finished with walking to the car, back to the house, my son went with the lawnmower and threw all the junk back in. But you know, the Heavenly Father, one day I was out there, and he laughed at me, and he says, don't you realize that all these weeds you're going to need someday? And I thought, okay. I thought this and this and this. Well, you're right. So now that has calmed me down.
It's interesting how people, when they come in and learn the benefits of dandelion, and they tell me how hard they've worked over the years to keep it out of their yard. Yeah. Well, let's open it up to questions. What questions might there be that y'all have? Yes.
I have a problem where I can't sleep if I don't have something going on. The moment it turns on, I'm awake.
Music-wise or noise?
Music, words, the radio, I have to have it on there. I cannot fall asleep.
Okay.
And I know I have a problem. I just don't know how to solve it.
Yeah. I would pray
Okay.
and ask God for help here, because we do know that it being quiet is better for us.
I agree.
And so,
I just can't seem to.
yeah. Have you tried?
Everything, but that one I don't know why.
What happens? What about a fan, which might be better than a radio? Does that help?
The fan's great, and I hear the noise. It's fine.
But that doesn't keep you. Words.
And music.
Yeah.
And it's good music. It's not like I'm listening to
Yeah.
something that's updating. I
Yeah.
can listen to hymns all night. But
Yeah.
it just has to be in that background.
What happens if you put a timer and it cuts it off later? Do you wake up?
I wake up as soon as I don't hear it.
Okay.
And I think it's as soon. I just know I wake up and I have to turn it back.
Try a
on,
timer.
and I fall
Yeah, try a timer and let it play for 30 minutes so you're more deeper into sleep, and see if it may turn it off. It's worth a try. Now, you mentioned something that I don't want to miss today, and then we'll come over here. And you talked about female hormones. The best thing that I have found for female hormones, nutrition is big. I mean, for women or for men, both of us, we got to have good nutrition for production of hormones. We got to have sleep. We got to have those 8 laws. They're just the foundation of what makes our bodies run. But in excess, wild yam cream is phenomenal. Wild yam cream. So we used to use, HRTs. We say Premarin, which is pregnant mare urine. Then we were using like twice cooked soy milk. Twice cooked soy milk, 1 cup of twice cooked soy milk. What's the doctor's name, Mary Lou? Dr. Gabriella Tolan. Gabriella Tolan, she was critical care anesthesiology, and she found that 1 cup of twice cooked soy milk, not once, but twice cooked. You cook it, you make it, and then you take it again and you like, what's it called in a double pan? A double boiler. And you heat it up again for 10 to 20 minutes. And when she tested it, it had as much estrogen as 1 Premarin did. But still, it really wasn't getting to where we were looking for. And then Dr. Lee in California came up with progesterone cream. But still, there wasn't as good of benefits. And then there was a lady, Cynthia Johnston, who worked for Dr. Lee. And she found that wild yam cream, transdermally, would stimulate progesterone, which when you stabilize progesterone, you stabilize estrogen, and you stabilize testosterone. And as we have worked with ladies now for over 21 years, that is amazingly effective. If the lady is still cycling, she then stops when she starts to cycle for 7 days, then starts back again. If she has 2 cycles a month, then she just continues through the second cycle, and we see those come in. We had a young gal a couple months ago. She was in her late 20s for over 10 years. She's had 3 cycles a month. That poor girl. And so we use several things. One is prayer for that poor girl. But the wild yam cream, and then we use the nettle. And the nettle helps to build the adrenals, and that has been very beneficial. I had this lady come in one time, and I was working at the herb cabinet, and she comes in, and she's dressed up like a cowgirl. This lady works at a dude ranch. She and her family own a dude ranch. Her husband came in the other day with spurs and everything, and they do what they do at a dude ranch. She comes in and she says, "Walt, have you got some nettle?" And I knew I was out of nettle in the bottle, and I said, "I know I'm out," and it's in a container like this. And so I pulled it out and said, "Yeah, I'm plumb out." I said, "Let me see if I've got some underneath." And I start looking underneath. She says, and I said, "No, I'm plumb out." She says, "You better get some in quick, or this county is going to make national news." And I said, "Why?" She says, "As many women as you and Mary Lou got on that nettle for women's hormones, we're going to make national news." It's amazing what nettle can do. And so we'll do a quart of water, bring it to boil, turn it off. You're making an infusion, and 1 quart of water and 1/4 of a cup, just a 1/4 of a cup of nettle herb, make an infusion, strain it, drink it throughout the day. That's very, very good. And the other thing is we found is flaxseed is a great phytoestrogen. Do 2 to 3 tablespoons twice a day, grind, eat within 15 minutes. Neil Nedley found that if you grind it and you wait more than 15 minutes, it oxidizes. And so you want to eat it within 15 minutes of grinding it. Based on your stress level, 2 or 3 tablespoons 3 times a day. And then there's a new item that Mary Lou's found, which is very, very effective for the ladies, Ester Sense. And Ester Sense has been also helping quite a bit. But that's what we use, and we have very good success. We really do. Yeah. Yes?
Her mind was settled down, that she wouldn't necessarily need those distractions of the word.
That's a good question Mary Lou has. If you took ashwagandha?
I take that every night.
Okay.
Every night.
Okay. So it's worth a try, yeah. Okay, next question. Thank you.
Okay. Is genital herpes a boil?
No,
No?
no. That's it's a virus STD.
Okay. Okay. So
Yes, ma'am.
how do we treat something like that?
Probably one of the best things that I have found, Allison is good. Also, there's some good studies on olive leaf extract. Olive leaf extract is an amazing antiviral, like shingles. The best thing, and I learned this from Dr. Agatha. Any of y'all miss Dr. Agatha? She was just a wealth, and she was so humble. I remember we were somewhere speaking one time, and to a group of physicians, and she was speaking on something on nutrition, and this physician raised his hand. He says, "But Dr. Agatha, you said this in your nutrition book." She says, "Yeah, I was wrong. One of my therapists found this out and told me, and I researched it. That therapist was right. I was wrong." That's humble. That's humble. And she was just great. But she taught me to use olive leaf extract. Do 800 milligrams 3 times a day. It's a great antiviral. Usually shingles are exacerbated by stress, so use the B-complex 100, 3 times a day with food. I say with food or something to drink because it can bother some people's stomachs. And then the other is, she taught me to use a charcoal poultice, but then one of the folks that come see me, they found that the poultice wasn't working as well, and they started trying castor oil. And that's before we started learning over the last several years about castor oil. This has been, 18, 19 years ago. And this lady said that she had better outcomes with using a castor oil pack than the charcoal poultice. So I started experimenting with folks with shingles, and we found that it worked better than the charcoal poultice. But back to your question, the olive leaf extract is an excellent antiviral. Yes, ma'am.
My neighbor has osteoporosis, extremely severe. She can't get out of bed hardly, except for go to the doctor and go to the bathroom. Do you have anything?
Yes. On osteoporosis, first there's several keys, and more for y'all than for us, for ladies than men. What I find to be effective in helping ladies in whether it's osteopenia or osteoporosis, and I've seen osteoporosis total reverse based on what their physician is now telling them. It's gone plumb. That is, one, you got to have adequate calcium in the blood. And I believe the best source of calcium is green leafy vegetables. That's a great source. Nettle is plumb full of calcium. But if you do take a calcium supplement, you want to take a 2-to-1 ratio calcium to magnesium, because it takes magnesium to help break the calcium, and you will lose. Already we talked about where this doctor in Chattanooga is finding 90 to 95% of Americans are deficient in magnesium, and now you're going to dump it even more because you're taking a calcium supplement that your doctor tells you need to take, and he didn't couple magnesium to it. You've got to couple a 2-to-1 ratio calcium to magnesium. If you do, 1,000 to 1,200 of calcium, 500 to 600 of magnesium. Number 2 is you got to pull the calcium out of the blood and put it pull it out of the blood. And I had a lady come in one day, and her physician had sent her to me to tell her what foods were high in calcium so she wouldn't eat those foods anymore because her blood calcium level was too high. So I said, how do you know? The labs. I said, do you have the labs with me? She said, yes. I said, can I see them? So she goes to the cart and brings the labs in, and I'm thinking, I hope he did a D. In the last page, there was vitamin D. And I mean, it was rock low. And I said, ma'am, what if we try this? Let's get your vitamin D up, because vitamin D pulls the calcium out. We got that vitamin D up, and she was fine. So it wasn't that she was needing to quit eating the foods with the calcium. Her vitamin D wasn't doing the job of pulling that calcium out. So you want a vitamin D level of 80 to 100, a good high level of that vitamin D level to do its job. And then NASA, when NASA looks at astronauts when they come back from space, they have bone density loss because of weightlessness. And the best tool that NASA found was, now be careful on the mini trampoline. Dr. Cherney taught me into getting some mini trampolines for our gym. He was out in Colorado, and he taught me into getting some mini trampolines for our gym. And we put them in. The next day, everybody was sick with flu-like symptoms. So I called Cherney and I said, Cherney, everybody I put on the trampolines are sick with flu-like symptoms. What do you do? Anybody know Cherney? He started laughing. Just a jolly fella. He starts laughing at me, I think. He's laughing, probably is laughing at me. And I said, Cherney, why are you laughing? He said, Walt, what'd you do? I said, I did 15 minutes BID twice a day. He just started laughing again. I said, Cherney, why are you laughing? He said, I did the same thing. He says, when you put a person on a mini trampoline 15 minutes twice a day, you turn their lymphatic pumps on high. It literally turns the lymphatic pumps on tenfold, we're told. He said, those people you get are sedentary people. They're full of all kinds of toxins. You just turn their pumps on wide open, and their liver can't handle it. They are having a Hertzheimer syndrome. He says, do this, you'll never have a problem again. He said, Cherney was triple board certified. He was a surgeon in his family practice, and I forgot what the other one was. But he said, do 5 minutes 3 times a day the first week, 10 minutes 3 times a day for the second week, and 15 minutes 2-3 times. What do you want to do after that? He says, you will never have another problem. And he was exactly right. And that was 20 years ago. And so a mini trampoline is what NASA uses, and that helps that G-force in that trampoline, that bone. It's called weight bearing. What's it called? Exercise. That weight bearing exercise drives that calcium into the bones. Now, what Dr. Lee in California found is that for females, you've got to make sure the estrogen's in good shape and the progesterone's in good shape also for bone density. So you want to do what we just talked about on female hormones, on making sure you have good estrogen and progesterone. I don't find that as much an issue with the fellows. With the guys, I usually use the first. Is she bedfast?
She says she is.
Okay, at least do what you can and ask God to make up the difference. Yes, yes.
I heard that, because I read down here.
Yes.
I heard that you can, even if you were sitting down and just put your legs a little bit and just kind of keep adding to it as you go along. Because even that little bit is doing something for you.
It's an amazing tool. Dr. Cherney said if you're on a trip and don't have your rim bounder, or if you can't afford one yet, he said just jump on the bed, but don't let the kids see you. And don't fall off. Yes, ma'am.
Well, I was going to say, when I read Dr. Lee's book and everything, he referred to the wife of someone big from South America that was wheelchair bound because of the osteoporosis. And when she was taking the progesterone that he suggested and everything, all of her symptoms went away, and she's out of the wheelchair and walking around now.
Okay.
So it just had to do with her progesterone levels.
Okay. If we can use that mic up here. Oh, okay.
Just the 3 T's for the bone density.
So the three, oh, yes. Thank you, Mary Lou. Oh, and there's something else for bone density. Yes. So oat straw, nettle, and horsetail is also good. Also another great one for bone density. And I had a lady, this is all she did. She went to Dr. Fletch's, and Dr. Fletch's had her do 150 milligrams of boron. Now, it took a little longer, but she went from full-blown osteoporosis. Her doctor says she had no osteoporosis, and she did 150 milligrams of boron a day, and that was another one. So the 3 T's that Mary Lou's talking about, and that's oat straw, it's horsetail, and I always ask which one, which kind of horse, a Clydesdale or horsetail, and nettle. Nettle. Okay, next. Yes?
Isn't there a difference between the cheap trampolines and the rebounder? Or
yes.
Because you can pronate your feet with the other.
Exactly. So there's 2 problems with mini trampolines. One is if the trampoline, if it has springs, and the springs are rectangular, then what it does is it rapidly stops you and it on both ends, which is harder on the joints and the organs. You want it to taper a little bit. Remember the old rocking horses we had as children, and you'd rock on them and they kind of tapered a little bit? You want that spring to taper. The other thing is you're exactly right. You can have pronation if you don't have a good mat. And the better the mat, the less pronation you can have, and that's better on your ankles and your feet. Yes. So you want a better quality. Yes. Hang on just a sec. There we go.
Dr. Barbara O'Neill says we only need 9 minutes of it per day. And I find that if I'm somewhere and I don't have my trampoline, I have a little one, I just stand and do the motion, just jerk. And I think that works as well.
Oh yeah, I mean you get that circulation going. Do a jump rope. Jump roping is great. Okay. Any other? Here we go. Got a question over here.
Is the I don't need that. I got a big mouth.
Oh no, for the people back there, the people online.
Are the capsules? Do they work?
For some people, they do.
Okay.
For some people, the tea works. Some people, the capsules work. The transdermal just works quite well for most people. But yes, some people use the capsules of wild yams. Some people do the tea.
How do you use the transdermal?
Transdermal, you just take the cream, and used to be you put it on the chest, you put it here, somewhere you blush, and blood would go to more prone. But now, then they said no over the ovaries, and said inner thigh, inner arm. Now they say just put it wherever. Just do it twice a day.
And that's better than the black cohosh?
Yes, I find it much better than the black cohosh. Now, the problem is if a lady has had a total hysterectomy, I find that we may need to use black cohosh. Now, also the wild yam cream, some of them come with, help me out, Mary Lou. Pardon? Vitex, thank you. Vitex or chaseberry. And so if you need extra, turbo power with that wild yam, you can do 2 mLs of chaseberry, or it's also called Vitex extract, and that can also help too. Yeah. Now, yes?
You're having stomach issues?
Oh, hang on just a sec.
If you're having stomach issues, like a lot of stomach cramping, carrot seed oil.
Okay. Very good to know. For bleeding, I get ladies that come in and have been bleeding for months. I had a lady not long ago that would have to sit on 2 towels because she was having so much bleeding. She'd been bleeding for months. And the best thing I have found is shepherd's purse. Normally it takes 1 day, but it took her 3 days. Also, you can use red raspberry, can be beneficial. Mary Lee.
Also, that's when the ester scents would come in to get rid of the excess bad esters.
Yes, true. Ester sense does come in good there. Okay, any other questions? Yes?
I was just going to say, as a child, I had gotten boils, and my great-grandfather was a doctor in Philadelphia, and I think my father had talked to him. But I remember my dad laying me down on the table, taking a milk bottle and heating it up on the stove in some water, and then applying that to the boil and pulled it, because as it cooled, it formed the vacuum.
Yes.
It pulled it right out.
Okay.
Really good.
Excellent. Also, tea tree oil. Tea tree oil can pull the boil to a head faster, so that's a good tool. Also, you can use a potato poultice. Or onion poultice, that's right. Okay. Any other? Yes, I got a question back here.
I have 2 granddaughters from 2 different sons, and I learned over the holidays that they both have iron deficiency, and they have very irregular periods. And so I was mentioning it to my daughter-in-law, who just really, she reads a lot, she's very knowledgeable, was going to be a nurse, was one degree away from getting her nursing license at one point. But anyway, she had been reading on that, and she said it's from the COVID shots, which both of our granddaughters did have the COVID shots. So it's really sad to see.
It is. I would try from the iron. One of the best things I found to increase iron is blackstrap molasses. A tablespoon twice a day of blackstrap molasses is a great way to increase iron. The best pill I have found for iron, most of your iron pills, you can have cramping, you can have constipation, and there's a product called Hemoplex by Nature Plus. You can use 1 to 2 of those a day, and it works extremely well. Cooking in an iron skillet has been said to be beneficial. And using the wild yam cream might also help with that. We're finding with issues with the vaccine shot, the far infrared sauna has been beneficial. And also Dr. Lee over in North Carolina, he's finding the melatonin, doing 180 milligrams of melatonin for adults is helping benefit with the COVID issues there with the shot. Yes?
You had mentioned 3 things that you would implement to correct type 2 diabetes and insulin resistance, and I missed writing that down.
Okay, so the first thing that we found is that your insulin receptor, insulin opens it up and allows glucose in, and everything honky-dory. But if with obesity, that receptor doesn't work as well. So shrinking body down to ideal body weight, it helps the receptor work better. Number 2 is where they found that if there's too much fat in the system, it could be oil, it could be dairy, it could be meat, the receptor doesn't work as well, and that's why at Duke, I'll think in a minute, Dr. Kempner found when he would take any type of fat out of the diet, that receptor started working better, Walter Kempner. And so that was oil, any kind of oil, any kind of use of dairy, any use of meat. Totally took that out, the insulin receptor would start working better. The third thing that Dr. Kempner found was inflammation. Now, Harvard finds the number 1 cause of inflammation. Right now, they're saying the number 1 cause of inflammation in America is processed food. Mm-hmm. Sleep deprivation is also huge in causing inflammation, and America has a lot of sleep deprivation. And so anything that may cause inflammation, those are the 3 big issues. Ideal body weight, take all fats out of the diet, and then, not all fat, fats, proteins, carbohydrates, but those, oils and dairy and meat. And taking away, trying to manage those issues of inflammation, such as, stopping all processed foods, getting your sleep, and those controllable inflammatory issues. Yes, ma'am. And there's a question back in the back. Is there a...
So if a person's eating meat, they're eating stuff that has iron in it.
Okay. Oh, but they're listening to you. They're listening to you online.
Okay. What I like to do is I like to put my clients on digestive enzymes first to see if it's a digestive problem that they're not getting enough iron, or if they have a copper problem. But, do you recommend that, or do you just have them
I used to
take
not.
the
I
iron
used to
pill?
not. I used to didn't agree with that. And I had a real good conversation with a physician friend of mine one time. And he just kept saying, no, Walt, they need the digestive enzymes. And I said, no, our raw fruits and vegetables have plenty of enzymes. And then I found out he was right, I was wrong. Because here's what happens. In 1902 or 1903, in order to have longer shelf life, they started spraying our foods with a byproduct of a pharmaceutical to try to get longer shelf life. Well, then they found that they could take them and turn them from heirloom to hybrid. And that would cause them to quit rotting as fast. Well, guess what? They found out they weren't rotting. What they did is they hybridized out amylase, protease, and lipase. And what happened was they were digesting. So in the Garden of Eden, you know, when Eve or Adam would go pluck something, they'd eat it. They didn't have to send it, you know, to California. They didn't have to send it from South America. They ate it right then.
Right.
And so in order to get that shelf life, they hybridized out those enzymes.
Right.
And so, yes, if we're not using heirloom foods that are fresh out of our backyard and whatever, I'm finding we do need those enzymes, because what they're now finding is like the pancreas and other organs that make enzymes are actually overworking because the body knows it doesn't have enough enzymes, and now we're having problems with those systems because we don't have enough enzymes. And by taking those enzymes you're talking about, it takes the stress off of them, plus we have better digestion.
Right. Okay.
I agree.
Thank you.
You're welcome. Yes, ma'am. For what's that? Tinnitus. Oh, yeah, that's a hard one. Yeah, tinnitus. Here's some things that are out there, but I haven't found a super bat yet. Now, go to NIH. The best research I've ever read on tinnitus was on NIH. Excellent outcomes. Guess what they used? You'll never guess. No? Kudzu IV. Kudzu IV. Now you got to find two things. One, Kudzu IV. Two, a doctor that will give it. But the best outcomes was Kudzu IV. Now, I'd like to see, I need to just take time and do this, but even just give a good amount of Kudzu every day to a person who has tinnitus and see if it may help. The next best thing I know of, and they've been using this in Asia, Indonesia, China, Malaysia, they've been doing this for years, is actually they have a little device. But you can take two tennis balls together, put them in a tube sock, and then place it right here and lay on it. And people are saying it's helping with their tinnitus. Tinnitus is not an ear issue, it's an inner brain issue. Some people have told me that I had a guy that told me he would use coconut oil on a Q-tip and put it in his ear a couple times a day. Now he only does it once a day. The tinnitus is under control. There's a product called Ring Stop. Helps some people, not a lot. I had an old farmer tell me he put tea tree oil in his ear every day and it stopped the tinnitus. So I don't have a big bat. Do you have one?
I have a neighbor that she had to cut all sugar, and she said every time she cuts sugar, the tinnitus.
Okay, so we have a person that says when they stop all sugar, the tinnitus goes away. When they add sugar, it comes back. That's a good... Okay.
If I'm not mistaken, tinnitus, part of its cause is because of inflammation.
Itis?
Yes. So if you deal with the inflammation, sometimes you can get it go away.
So you got to figure out where
it could also be related to food sensitivities, the allergies.
Yes.
So then the issue is identifying which one.
That's exactly right. And then the other one is dehydration. We know that dehydration can increase tinnitus. And to go with what he said, did I tell you the story about the 18-year-old girl that was like an old woman?
No.
Did I tell? I may have told some of y'all. So a couple years ago, 2 years ago, a year and a half ago, I was speaking up in Minnesota. And I see this girl that I know the family. I've known the family for 10 years, and they're a farming family. The mother used to be a nurse, and father's a builder, but he's also, they're farmers, a great family. They come and see us at the store sometimes. And I see the mom helping the girl ambulate, and she's ambulating like a 90-year-old woman. And I went to the mom and I said, "What's wrong?" And she says, "We don't know." She says, "I've taken her all over the place." She says, "I even took her down to Mayo." They're in Minnesota. Took her to Mayo. And Mayo says she's going to be an invalid the rest of her life. 18 years old. Well, that's not an option. We got to fix this. So I said, okay. And so I talked to her afterwards, and her dad and her mom and her sister, and we prayed. God, give us wisdom. What do we need to do for this girl? She can't be like that. I mean, this girl was a wide open girl, had all kinds of energy. And we prayed. And I said, juice. Juice. I felt just juice. And I said, do it for 60 days. And they said, okay, we'll go pray on that. So Mary Lou and I saw her a year ago this coming March. So we're looking at 9 months later. And she's in Tennessee with a group from Uchee Pine. She worked for Uchee Pine. She couldn't work anymore because of this condition. And there she was, just wide open again. And I said, oh, what'd you do? And she says, Mom and I prayed on it. And she says, we felt God wanted us to juice 90 days. 90 days, not 60. It went away. She said, then I started adding food back and boom. So I went back to juicing. And she said, every time I added this only one food in any form, I was back in the same condition. She says, as long as I read all the ingredients and that food is not in that food, I'm good. Soybean. Soybean oil, soybean of any structure would put her right back in that condition. And so like you said, figure out what that cause is. And juicing is the best way I found to go do that. Yes?
So you're saying the 90 days of juicing, is that all they're taking into their system, just the juice?
That's all they did.
Any other food?
That's what they did.
Just
And
that
water.
juice?
And water.
And that is a vegetable juice?
Yes. You can put a little apple with it, like Granny Smith or something.
Just to make it more flavorful?
Yes. And the question he had was, are we talking just juicing? No, we're adding water to it, so it's juice and water. But if you've ever juiced, there's a lot of food there. Yes. Like when Mary Lou makes a green juice, she'll put 4 big leaves of kale. She'll put 2 hands of spinach. She'll use half of a bunch of parsley. She'll use, if we're doing a lot of juicing like that, we'll use 4 stalks of celery. We'll use 1/4 of a cucumber. We'll use 2 to 3 apples, depending on size. We'll use a half of a lemon. We'll use a piece of ginger. If Mary Lou, it'd be as big as her fist. But a piece of ginger that person will take, and if she can, she'll put turmeric in it. That's her green drink. That's a lot of food. Pardon? Mm-hmm. No, it's a juice. You take the fiber out, and here's why. When you digest food with fiber, it takes 2.5 to 5 hours to digest. When you take the fiber out, it's in the blood within 15 to 20 minutes, and now that extra energy for digestion can go for healing. It's a therapeutic thing. It's not something to do all the time.
My friend watched your talk on hydration online, and he asked me this morning, he goes, Mike, ask him what's the best way to tell if you're truly hydrated? What's the best way to monitor that for yourself?
He can check skin turgor. Y'all know skin turgor. Pull the skin up and see how quick it snaps back down. As we get older, that's not as accurate, we're told. But we've used that for years in healthcare. Look at the urine. Oh, they did a study. This was back around 2000 over in Europe. They compared the best lab test for looking at hydration. It was at that time it was a $700 and some lab test. Now that's a expensive lab test, or they claim. They compared it to another simple test, and it was just as accurate, and that was the color and odor of the urine. Yeah, you want it, but you can look at something called conductivity. And conductivity will tell you hydration also. And conductivity is the measurement of electricity in the body. If a person is dehydrated, conductivity goes up. If they have too much water, conductivity goes down. And so you actually can measure it by a conductivity test. And if you're in the Navy and you work on ships, you know conductivity very well. Pardon? No, it's different. Something different. Okay, there's a question over here. Oh, we got one here, and then we got one there.
Somebody mentioned potatoes. Well, my old granny up in Sneedville, she would remove warts with raw taters.
Uh-huh.
And I seen a lady, her husband had blindness from welding blindness without goggles.
That is the best.
And she just kept putting grated raw taters on there up until they stopped cooking them.
That's right.
And then his vision was perfect after that, had no after effects. And once I had blisters, I had sunburned my neck so bad I had blisters.
Mm-hmm.
She put it on my neck, did it 8 or 10 times till they quit cooking, got rid of the blisters.
Absolutely. I had a guy one time, he came in, he had he's a maintenance man, and he was working on, a furnace had gone out. And so he went to the propane tank, and he turned off the valve on the propane tank. And then he goes to the furnace room. It was a big building. He went to the furnace room, turned on the light switch, and the light didn't come on. Well, that wasn't a problem. He had a lighter. So he goes over then to the propane heater for this big building, and he goes, and he goes, now why it didn't have more explosion than that, I have no idea, but the valve over here didn't work. And so it didn't, the valve was faulty on the propane tank, but it did explode. And he had he had a long sleeve shirt, but from here up was burnt. No, he had no eyelashes, no eyebrows. It burnt the hair off up here, burned it back. His face was burnt, and then his face looked like a 1950 Chevy with flames on it. So he was burnt, and then there was deeper flame stripes on his face. So we brought him in, laid him on the exam table, and the first thing we did was we used aloe vera gel. And his face soaked up a quart of aloe vera gel. And then my grandma taught me about tater poultices. And so I had dietary department grade me potatoes while I was doing the aloe vera. And then when the aloe vera is gone, I put the tater poultice on there. Now, how do you know how long to leave the taters on there? If you go, who's ever used vinegar for sunburn in a washcloth? Yeah. And so you put that washcloth on there. When that washcloth gets hot, you pull it off, put it back in the vinegar, put it back on. And when it gets hot, same thing with the taters. So you leave it there until the taters get hot, and then you pull them off, and then put more taters on there. Yes, they will. And we just kept going back and forth between the potatoes and the aloe vera, and we ran out of aloe vera. Well, we had a physician from the Philippines come and visit us and donate to us a lot of aloe vera plants, and they were in our greenhouse. So I had several therapists from Colombia and Venezuela. I sent them to get the aloe vera and make aloe vera gel because they were from Colombia and Venezuela, and they knew how to do it. And they'd worked in lifestyle centers down in Colombia and Venezuela. They had used it. So they made the aloe vera for me. And we kept doing it back and forth for 5 hours. Now, on his eyes, we just put a big old piece of aloe vera, and we kept changing that out. So the only place was where he could breathe, through his nose and everything. And we brought his wife in, taught her what to do. He then went from there, went back home. She kept doing it. He had zero scarring. Now, the surgeon that was there working with us, he said if I had had anything in the ER like what I had there, that the degree of burn that would have had scarring, just how bad it was. And he had no scarring, none at all. And it was potatoes. Yes?
I was thinking my grandson was bit by a brown recluse, and we'd gone to the doctor and everything, and my daughter called me about it, and I told her to take a thick slice of onion, take some tape, duct tape, tape it to the area and everything, and it pulled all that out, and he had it healed up fine without any problems at all.
A charcoal poultice. She's saying that the person had, and I'll have to finish real quick. We're at 12 o'clock, but I have, for brown recluse, a charcoal poultice will work excellent, just like what happened there. We'll take just a couple hands and we'll have to finish it. Is there a mic? Oh, go ahead.
Yeah, I was just going to say that when you were talking about digestive enzymes, I have found that inkhorn sourdough crackers will completely take care of that.
That's good to know.
Yeah.
Okay.
The inkhorn grain, which is an old heritage grain.
It has 14 chromosomes.
Yes, and they have sourdough crackers that are made with the inkhorn grain. If you eat those on a regular basis, you won't have to worry about taking digestive enzymes.
So it has enzymes in it?
I don't know, but you don't have to worry about it because, I used to have a lot of gut issues.
Okay.
And then I started eating those crackers, and I
Okay.
eat
Excellent.
maybe...
They would be low in gluten.
Yeah.
Yeah.
Well, it
They
definitely
work-
wouldn't have the bad stuff in it.
Yeah, and they work excellent.
Yes. Okay. Thank you.
Is there a natural remedy for torn tendons or tendinitis?
I would use hydrotherapy,
Okay.
the hot and cold. I would also use far infrared. We're having just remarkable improvement of tissue. I had a lady come in. She had a fracture arm. She had a regular plaster of Paris, regular hard cast. Her orthopedist said she was going to have surgery. It was not healing. We did far infrared light on that, a 700-watt bulb on there. It actually went through the plaster of Paris. In 5 days, she went back to the orthopedist and said it was healing. A friend of mine he's a physician in North Carolina. He uses far infrared. He had a young girl, had a fractured tib fib just above the ankle. Surgeon said he was going to have to do surgery because it wasn't healing. He says, give me 2 weeks. He had the girl come in 5 days for 2 weeks. He did the far infrared light. He did the far infrared sauna. 2 weeks, she went back to the orthopedist, and there was healing. Far infrared is amazing for healing tissue, for healing bones, healing tissue, because it increases perfusion, and you're increasing that vascular flow to that region. At home? Oh, thank you. Yeah, exactly. And also comfrey. That's exactly what else you want. Put a comfrey poultice on there. A comfrey poultice. Yes. Okay, someone got a mic.
We shut them off.
Pardon, we shut them off? Okay, so we're off. Yes. So hardening of the arteries, you want to look, do you also have clogged arteries? Look at the diet. You can have hardening arteries also in conjunction with what happens with clogged arteries, or you're saying arterial sclerosis.
All I know is that I had cataract surgery. My doctor said that they noticed, the surgeon noticed that my arteries were not as large as what it would come down to the vein size. And they said they just wanted to give me a heads up that something was going on.
Did they say they were hardening or getting clogged up?
They said
Narrowing. Okay. So diet's important. I would do the lecithin granules and the flaxseed oil. Yes, a tablespoon 3 times of the lecithin granules, and a tablespoon twice a day of the flax oil. Yes. And I've got, my doctor told me one day, he said, Walt, he said, I never believed this would happen, but he says, I'm having eye diseases. Excuse me. Patients coming in with eye problems. Excuse me. And when you're doing the Duke program, their conditions are healing. And I would try the Duke diet. Yes. Yes, sir.
Yeah, I was going to ask you about, I have family members that are over in New Mexico, and they're big into gut health.
Mm-hmm.
And so they buy good quality yogurt, not flavored or whatever,
Mm-hmm.
not a bunch, no sugar. And then they do the kefir.
Mm-hmm.
And so, and they're just, what would you say about that for gut health and about that kind of thing? I know you shared with me that
Yes.
you being raised on a dairy farm,
Mm-hmm.
and what it did to you and where you are today because of that.
Yes. There can be benefits in things, but also you want to look, is there anything could be harmful? And this blew me away, totally blew me away. When Dr. Campbell told us that, and also Cambridge University's found the same research as Cornell did. Dairy is the most significant chemical carcinogen ever discovered. So if it comes from dairy, that kefir or the yogurt or whatever, dairy is the most significant chemical carcinogen ever discovered. And for children, now, Dr.
Now, is that because of the way they have dairies today?
Well, it doesn't help, but they found, yes, it's the casein's what it is. He's exactly right. It's the protein. It's the casein. When we were on the plateau, just on this road right out here, just drive on down this road, we were just a quarter mile off 111 on Cagle. Our cows produced about a little over 2 gallons of milk a day. I went to a dairy farm just recently, over 2,000 head. Those cows, none of them had ever eaten a blade of grass. They were generating over 20 gallons of milk a day.
Per cow?
Per cow. Per cow. I had a dairy farmer come in to see me recently, he and his wife, and I like cows. I mean, I like animals, but I like cows and dogs the most. And I said, we were talking about the cows and what kind of cows they had and what all. And he said, I ain't got no bull. I said, you don't have a bull? I said, well, we did AI. Are you doing AI, artificial insemination? He goes, no, I don't do AI either. I said, well, how do you have calves? He says, we don't have calves. Well, how do you get milk? He says, well, I just take a heifer, pump her full of hormones, milk her for 2 years, and beef her out. He's a dairy farmer. People are buying that milk. And so, you just want, and I mean, it totally blew me away when I found that out, because that's what our family did for generations. I mean, literally for generations, we're dairy farmers. So, but it's interesting, here Dad is a dairy farmer, and he goes to UT, and he takes agriculture, and he gets his degree in agriculture. And at that time, in the 50s, I noticed as I grew up, Dad would never drink milk.
Who did?
My father. And he's a dairy farmer. I said, Dad, why don't you drink no milk? He said, I just don't care for you right now. He wouldn't tell me because my mom was there. And my mom came from a family that was in healthcare. And, you got to have your milk for the calcium and the bones and whatever. And so he just didn't want to get in a fight with her. And so he didn't say nothing until after she died. I said, Dad, why didn't you drink milk? He said, because milk is for calves. They taught me at UT that milk is for calves, not for humans. And here he's a dairy farmer. Yes, ma'am.
Yeah, what would you give a baby then who was just weaned off the breast?
Well, I think that is the best milk, best food that a baby could ever have. And if they could breastfeed for 2 years, that would be great for them. You're saying just from weaning, at what age are you talking about?
Well, she's a year old. And
Okay.
I was talking about weaning her off the breast.
Okay. Is she willing to go longer?
She probably would, yeah.
Wouldn't hurt?
She's 12.
Well, I don't know if I'd go that long.
But my great-granddaughter
Yeah.
was already weaned off the breast, and she was not good for her.
Yeah.
And they put her on cow's milk, and it just makes me cringe.
Yes. When I was a little boy, I could not nurse for my mama. I don't know why. It didn't do any good for me. So they tried cow's milk. Then they tried soy products and whatever formula they had at that time. My weight got down to 4 pounds. Now, how many of y'all know George Graves or Charles Graves? Okay. Charles, okay, he's the guy that delivered me. He was a family doctor. So Dr. Graves tells my folks, try goat's milk. I got so fat they had to water it down. And it worked. It's better than cow's milk. Yeah. So to answer your question, if she can go longer, and he's the guy that can answer the question on what to feed it, but just start eating food. But at a year, it should be eating food after a year.
Well, for some reason,
You don't need the milk. Yeah. Continue with the breast milk and start introducing food. Would you agree? I mean, they're finding that breast milk increases bone issues, immune system, gut health, and now they're even finding that person who breastfed has better cardiac health. And so there's a reason God gave women milk. And higher IQs. Oh, I've got to quit, y'all. But let me share something. Y'all want to learn how to increase the IQ? This is so cool. So, if the mother will take 12.5 milligrams of iodine during pregnancy, especially in the 2 trimesters, just like you would with folic acid, and then when she then starts breastfeeding, go to 25 milligrams for 2 years. And then when the baby can start chewing, give the baby 3.125 milligrams of iodine. They're finding it's increasing the baby's IQs 10 to 15 points above their mother's IQs. Now, this research was done in North Carolina. Germany found out about it. Now, Germany is doing a study to prove that study, but they're doing 25 milligrams when the mother's pregnant, going to 50 milligrams during pregnancy. It's so early they can't really tell the IQ yet, but it appears they're having better outcomes than they did in the North Carolina study. And so if you want to increase IQ, iodine is so important. Yeah, the CDC tells moms, do not use fluoride. Why? Fluoride inhibits the absorption of iodine. Yeah. Pardon? Yeah, fluoride, chlorine, and bromide, all 3 of those. Yes. Okay, one last question. That's exactly right. In Central America, they use coconut milk also. Yes, coconut water. Yeah, coconut water. In Central America, that happens. If the mother doesn't have enough milk, they'll give coconut water. Absolutely. Okay, Pastor, I could keep going, but y'all have a funeral to go to. And then Mary Lou has some stuff back there for you.
Hours goes by pretty fast, doesn't it, folks? Be blessed.